for my uncle who has an intellectual disability. Let me go down the list that I have of people here. So Adriana, if you'd introduce yourself.
Hello all, Adriana Ramirez. I'm here from Connecticut Family Support Network. I am the statewide Spanish-speaking family coordinator. Hello.
Great, thank you. Annette.
Hi everyone, hi, I'm Annette Scully, Vice Chair. I am a parent of a 30-year-old and guardian.
Thank you. Donna.
Hi, I'm Donna Cohen, and I'm the parent of a 29-year-old girl with autism and intellectual disability and guardian.
Thank you. Ellen and Kim.
Hi, I'm Kim Little, and I'm the parent of Ellen Little, who has an intellectual disability. I also work for Creative Living Communities in Coventry.
Great.
Hi, I'm Ellen. I have a disability myself as my mom.
Lori.
Hi, everyone. I'm Lori Coughlin. I'm a parent of a 34-year-old woman with ID who lives in West Hartford.
Thank you. Claudia.
Hi, Claudia Newman, Executive Secretary for the North Region.
Thank you. Tammy.
I'm Tammy Solinger, and I'm the mom of a 30-year-old girl and a 28-year-old boy, both with Fragile X syndrome. My son lives in a group home in West Hartford, and my daughter still lives with us.
Thank you. Susan, I think I accidentally skipped over you.
My name is Prihar. I am the mom of a 24-year-old severely autistic young wonderful man, and he is currently in a group home in Windham, Connecticut.
Great, welcome. And Stacy.
Hi, I'm Stacy Silva Gordon. I am the newly appointed regional director for the North Region.
Great, and welcome, Stacy. We're happy to have you.
Thank you.
And it seems somebody else just joined. Melissa? I believe Melissa just joined. Melissa, if you would like to unmute yourself, I know I'm bombarding you, but we just are finishing introductions.
There we go. Hi. So, my turn, I guess, because I just popped on last. So, my name is Melissa. I live in Rocky Hill. I'm a mother of 3 boys, all with learning disabilities, ages 18, 16, and 13. So,
great.
Yeah.
Thank you. Thanks for joining us, Melissa.
Yep. Thanks for having me.
And you're no longer the last one, Melissa. Donna, would you like to introduce yourself? Donna Clausen. We can give her a second. Rick, would you like to introduce yourself?
Yes, my name is Rick Rothstein. I am the past chair of this committee and past chair of the board at HARC, where my son is in a group home on Asylum Avenue. He's been in the residential program for 30 years. He's 38 years old. And I also serve on the Council on Developmental Services, where I'm currently the secretary. So welcome aboard, and we look forward to working with you.
Thanks, Rick. Donna, would you like to introduce yourself? Donna Clausen.
Donna Clausen, I'm a 37-year-old daughter who is supported by the agency.
Great. Okay, and just a general reminder, this is a public meeting. It's being recorded. So everybody, before you speak, if you would introduce yourself. I've been told that that is helpful for the transcript when they write it out later on. And just logistically, if you're not speaking, if you could put yourself on mute, that helps with the audio overall. Alrighty. So I'm looking back. All right, so next up on our agenda, we have the approval of the minutes from our last meeting, which were circulated by Claudia. Can I please get a motion to approve the minutes?
I approve.
Thank you, Annette. Can I please get someone to second the motion? Okay, thank you, Kim. I saw you raise your hand. All right, given that we're virtual, are there any opposed to the approval of the minutes? Okay, hearing no objections, the minutes are now approved. All right, very good. I apologize, I have to keep flipping back. All right, so next up we have our legislative update, and the session is ending in a few short weeks. Rick, I always defer to you. If you have any updates, please feel free to share. You are on mute, Rick.
This is Rick Rothstein. I will have to admit that I've been a bit lazy this session and have not been following things as closely. There is an agreement on the budget, although the governor hasn't weighed in yet. And there's reasonably good news in the budget for DDS. I know providers would still like to see a cost of living adjustment annually put in by statute. There's no report as to what's happening with that. I think if it happens, it will happen at the 11th hour in the implementer bill or something like that. So that is the biggest news. I know Carol Scully last month mentioned the insurance bill, HB 5042, which could conceivably cause some issues for our family members because the legislature is taking up a proposal from the governor, which they've been actually working on since he was brought into office, to increase spending on primary care to 10% from 5%, and to reduce the spending on specialist care. Well, many of our folks need a lot of specialist care, and this would require agreements with Medicaid, Medicare, and negotiating with all the health insurance companies, because it's not just applying to state expenditures, it's applying to all expenditures. The thought is that if more money was spent on primary care, then we wouldn't have as much in the way of emergency room visits and chronic disease. I know there are folks, including the ARC, Disability Rights Connecticut, and other non-disability groups that are very concerned about that. And there are some proposed amendments that are being considered to that may make the impact of it less, not as bad for our folks, and maybe tail back the 10% to something less than that. There's, in a separate bill, there's also a targeted amount of, there's also, so there's a targeted amount of spending, and there's a roadmap to how to get there. Those are in two separate bills. The other bill is Senate Bill 15, and I don't believe either one has gone to the floor of the House or the Senate yet. So the roadmap is a bit difficult to follow. It was developed in a very convoluted fashion. There were two representatives from the disability community that participated in different parts of it. It was mostly controlled by the Office of Health Services and an outside consulting firm. And quite interestingly, in the 36-page document that lays out the roadmap, the name of the consulting firm is not mentioned once. and there was no overall group of advocates, health advocates, or families or providers that saw the whole plan. So it was really developed internally by the Office of Health Services with the consulting firm. So everyone contributed on their little piece, and no one saw the whole thing except for OHS. So those comments have been passed along to members of the General Assembly, and several groups did testify in the to the public health, to the insurance and real estate about it. Something else that's unusual is, to me anyway, and I did pass this along, is although it proposes major changes in our healthcare system, this did not go, and to Medicaid, this did not go to the Public Health Committee and did not go to the Human Services Committee. So those decisions as to what committees bills are heard by are made by the leadership. So and if they're referred back to those committees now, they would just, the bills would just die, and that is not typical for a governor's bill. Governor's bill typically sail right through. So that's really all I have. I am missing the report that used to come out of central office on legislation, which I know Kevin Bronson was here at our January meeting and did say that that would be resuming again. And I know I haven't seen one. There isn't one on the website. So Rod O'Connor used to do an outstanding job of scanning everything that was out there, regardless of what committee it was in, and identifying if it had any relevance to our population and to the department. And there wasn't any opinion expressed on any of the bills. It was just, here are the bills that are out there and where they are. So
thank you, Rick. This is Kathleen Hayes. I would say I never received Rod's emails, but was looking forward to being updated. And I think I remember Kevin, I think, said they were working on some sort of portal on the website. Maybe they had some tech issues in getting that up this session, but hopefully it's up for next session. Okay, does anyone else have any other updates legislatively that they would like to share? Okay, thank you again, Rick. Next up on our agenda, Stacy, we have your regional director's report.
Good evening, everyone. Again, this is Stacy Silva Gordon, the regional director. I just wanted to share some information on a memo that we did send out to private providers just yesterday, and it's in regards to what we refer to as the ARPA funding, which is the American Rescue Plan Act of 2021, that enables the state to earn extra 10% back on federal reimbursement on Medicaid waiver services. And so we shared with the private providers that we would like for this money is basically going to be used to enhance, expand, and to strengthen, the service system. Number one, we would like the providers to use the money towards their workforce to help stabilize their workforce, and assist with recruitment and retention of private provider staff, because that's a dire need right now. We also want to expand our services by utilizing assistive technology that would help to, promote some more independence in our congregate settings, and while at the same time maintaining quality and, oversight for health and safety. Another area was in regards to service delivery, some transformations in regards to housing models for us to, collaborate with more of our sister agencies in transitional housing or supportive housing. and also to develop like incentive programs for the providers to be able to look at their current vacancies, maybe consolidate to, you know, save some money in order for us to put towards individuals that are currently on the residential waiting list. And, you know, consider moving people that can go to a more independent residential setting, and also to be cognizant of competitive employment, of, you know, less group supported employment, but more independent competitive employment. So those are a few things that were, you know, we had shared with the private agencies in a memo that just went out yesterday.
So just to be clear, Stacy, I may have just missed it in the beginning. So the ARPA funding will give you and the state an extra 10% reimbursement from the federal government. Is that right?
Correct. Oh. Correct. Reimbursement on the Medicaid waiver services.
Perfect. Okay.
Which we're going to share with the private, you know, provider community.
Right. Great. Okay. Yeah, and hopefully that helps with the staffing shortages.
Yes, I hope so. That's a great concern right now.
Yeah. Great. Okay. Thank you. Does anyone have any questions for Stacy? All right. All right. So the next item on our agenda is to talk about, oh, Rick, yes, I'm sorry. Go ahead.
Okay. I don't know what's happening at other agencies. This is Rick Rothstein. I don't know what's happening at other agencies, but my son's group home at Hark has been extremely short on staff. And it wasn't helped by the fact that we had 2 cases of COVID on the staff and 2 cases of COVID on the residents, including my son, for the second time. And I know his mother and I are very concerned that it's really at the level where it's really a crisis. And I don't know what the department can do, but just so that you're aware of it and that families are concerned about it. So
thank you. I did have a meeting today with the executive director to have that very discussion that you're speaking of. Case management did bring it to my attention, and we are carefully, you know, watching that house.
Yeah. And since this is the first meeting you're here, I will compliment our case manager, Deb DeVivo, who is certainly the best or one of the best. And we're very fortunate that she's still with us and has been for so many years.
Thank you. I absolutely agree with you.
Does anyone have any other questions for Stacy? Okay.
I guess I'll jump in. Sorry, I'm going to jump in. I was trying to figure out how to unmute.
That's okay. If you would just state your name.
I'm Sue Prehar, and I'm the one that has an adult son in a group home setting. Ms. Sylvia Gordon, my question, and I'm going to completely respect if you say that this is something that should be brought up in private. But if an agency decides that they no longer want to service their clients, and by agreement, the parents of the clients agree that they should no longer be running a group home, we've run into an interesting situation where there's no one to replace them. What is the typical scenario, or what can we expect? And again, I will totally respect this if you tell me that this is a private conversation, but what is the fail-safe for an agency that, quite frankly, has done an incredibly poor job of managing their group home, acknowledging that and saying that they're giving notice, and then nobody else wants our guys?
In this situation, we try very hard to work collaboratively with the agency to maintain health and safety while we explore alternatives. And we could definitely, take this offline to discuss it further specifically, because I definitely am involved in that as well.
Thank you. Thank you very much.
Okay, anybody else have anything? All right, so next up on the agenda, we're going to talk about any upcoming presentations, thoughts, or things that people would like to hear. I know at one point I had mentioned that I'd be happy to do a supported decision-making presentation. So I would be happy to do that at our next meeting if we don't have anyone otherwise scheduled. I see Claudia nodding, so I guess that sounds
If I
good.
can just jump in, that would be great. Elisa had suggested that, and she wanted to put it out to the other regions and possibly have more, so that they could have participate as well. So yeah, if we could do that for the next meeting, I'll put that out there. That would be great.
Miss,
Definitely.
I don't know. How do I raise my hand? I'm so sorry.
Oh, I'm sorry. I there's so many boxes. I didn't even know who was talking. Yes, Susan?
Sorry, Sue Prehar again. Is it possible for us to ever have a roundtable discussion, or just a discussion in general about how to troubleshoot when things aren't going well? Because I'll be honest, when everything's going great, it's easy, right? We're gloriously happy with everyone. We're very complimentary. Everybody's getting Christmas presents. But when it doesn't go right, when you have people who are making very, very poor choices, and the health and safety of the clients are in question, I don't think it's really clear who to go to. And I'll say our case manager is lovely. Never a problem with their case manager. But there's not really a go-to. I mean, obviously, Ms. Silva, or you are very busy. You're not the person that's the go-to. But who is?
That's a good question, Susan. And I think that I think we could all benefit from each other's knowledge on that, to your point, that everybody at one point or another, I'm sure, has had some sort of difficulty. So I think a roundtable would be helpful. I think in the short term, if you have a current issue that you don't know how to navigate, we do have Shannon Giacovino now as the DDS ombudsperson. So she would be a good point of contact if there's an issue and you're not sure how to navigate it. That is her role, to basically help you to work through the issue and connect you with the right people. But certainly your point is well taken about having an agenda item to discuss that. Possibly next fall, if we're going to do a joint presentation next month, that might preclude our roundtable because there would be so many people present. So maybe we can put that on the agenda for September.
That's fine.
Okay, Annette?
Hi, Kathleen. Annette Scully. Hi, Kathleen. You said that you were going to do a presentation on the, what you called it, the decision-making process. Can you, would it be possible if you touched on special needs trusts? I know it's been done, but I want to hear what you think. What?
Sure. It's a different topic.
Okay.
Than supported decision making. I mean, I'm happy if time would permit. I'm always happy to talk about special needs trust as well, and do maybe I can give a nice overview, so maybe like a 10 to 15 minute primer on special needs trusts, and then do kind of a more full-fledged presentation on supported decision making. And the way that I typically do this presentation is supported decision making is a newer concept, so I focus a little more there, but I also talk about other decision making options, so how guardianship and conservatorship work, and also talking about powers of attorney and healthcare directives, because all of those things are part of a spectrum of decision making. So not any one option is going to be the right option for necessarily everyone, which is why I like to talk about everything in context. That's just a little further background on that presentation. But yes, I'd be happy to incorporate like a special needs trust primer next month as well.
Thank you, because I always understand what you're talking about.
Oh, thanks. Hopefully I don't let you down.
Thank you.
Yes, Rick. Rick, are you in the process of unmuting? There we go.
Yes, I'm okay.
Yep, we can hear you.
Okay, you had a question for me?
Oh, maybe your hand might still be raised from earlier.
Okay,
I'm sorry.
I will take it back down.
Okay. All right. So Ellen and Kim.
I don't really, it's interesting. I don't have a question per se. Well, I guess I kind of do. In terms of people who could attend something about supported decision making, I know our Commission on People with Disabilities in Holland has thought about presenting the same thing. Would they be able to then attend this meeting and hear about it?
Absolutely.
Oh, that would be wonderful. Wonderful.
Yeah. It is a public meeting, so we'll make sure that as part of the notice that we get the link out so that you can share it.
Okay.
As needed.
That would be wonderful, and the sooner would be great if we can have it a little sooner. Then I guess this is more of just an FYI, and that is that there are probably about 10 groups of parents who are purchasing residences for their young adults. And a lot of us are running into a lot of snags having to do with support, how those supports come together, and getting a really good understanding of how to make things go smoothly. We're getting really frustrated. Like I say, some of us already have purchased places, but we're having difficulty kind of meshing the two individuals' supports.
You're talking about funding sources, like a DDS budget with Community First Choice or something like that?
Exactly. Because my understanding is that if, say, that the two individuals both had DDS funding, that would go relatively smoothly. I'm not sure. I'm kind of just from what I've heard. And then I just recently discovered that as my daughter has CFC funding, she cannot live with another person who has CFC funding. That CFC funding is only for one individual. I don't know.
Yeah, this is Kathleen. That's not my understanding. Maybe that the budgets have to be allocated individually. Lori, I see you have your hand raised, and I'm almost even wondering if I'm sure you have a comment now, but maybe this is a topic you can present on. I know that you help families to self-direct services, and maybe this is a piece of that.
Yeah, hi, it's Lori. I'm struggling with combining the funding sources myself. Getting clear information from CFC on the billing piece. So say, for instance, you have two consumers, they both have CFC funding. Now, I was told that they could only bill out. So if they had two CFC consumers together, they could only bill for one at a time and then bill for the second one. So I am going to Dawn Lambert, who is over the CFC, for clarification on that. I don't know if Kim, you have spoken to her yet. I spoke with the supervisor of CFC, but even, putting together a 24/7 is really challenging with those different funding sources, and even she couldn't give me clear cut information. So I decided I'm bumping it up a little bit higher because I'm running into that with a family down in the South region.
Yeah.
We're trying to utilize different funding sources, but for this consumer, he needs 24/7. And it's really challenging. It's really challenging getting all the pieces together. So I am going to go to Dawn and get clarification on that CFC money.
Okay. Dawn is
DDS funding can certainly be self-directed. CFC money has to be self-directed. Absolutely has to be self-directed. What I was really concerned about was the same thing you are. It's a funding for one person. Well, according to CFC, if there are two consumers, that one person could bill out 12 hours under one person and then 12 hours under the second person. It gets a little sticky, and I really need clarification on that particular piece. So I'm pursuing that, and I'll be able to give you some information on that as well. The whole purchasing of a house as well, that's I'm running into issues with a family member purchasing a house, and that has to go through the legal department for permission.
Yes.
There's a lot of pieces. And I would love to talk to you about what you're doing.
Yes.
We could kind of compare notes. But I am going to get more information on that funding piece from CFC.
Yes, I would love to talk to you about it. And also, there are other families faced with this same situation. And Net's waving. The other concern to me is that it just seems logical that if you could combine two individuals who have CFC funding, that actually you would be saving money. And it just seems kind of silly that they wouldn't do that. So. But yeah,
and they told me it could be done, and this was Cindy. I can't remember her last name, but she is a supervisor at CFC. But again, she wasn't familiar with a 24/7 model. She said we could bill separately. I need much more clarification than that, so I'm going to take it up.
Yep.
Higher. Okay.
Yeah, Dawn is lovely. So
yeah, I worked with her about 2 years ago with a young man that we set up independently, but he had a lawn of a 2, and I'm working with a family who has a son with a lawn of a 5, and that's challenging.
Yeah.
So
okay. Thank you.
Okay, I will keep you posted on that. I am in the process of getting an email out to her for more communication on that.
Wonderful. Thank you.
Okay.
This is Kathleen Hayes. I think that it's a good point, though, that this is something that we should spend some time on as a topic. So maybe Kim and Lori, whatever you gather, I think what we really need is a presentation with someone from DSS and someone from DDS. So that whether it's someone from maybe someone from Allied that would be implementing like a CFC budget, and then I don't know if there's someone at DDS, Stacy, I guess I would defer to you, whether there's someone that knows how to manage this combination. I know I've worked with some very skilled case managers in the past who are used to trying to put together some sort of housing things, usually people that are well-versed in the self-direction. But if you have any suggestions as to a DDS representative, maybe we can just if we can identify someone from DSS and DDS and get them together, maybe Lori and Kim, you could put together a list of questions of the things that you've encountered and struggled with and the things that those other families have struggled with. And then we could submit that list of questions to both of these point people and then have a presentation where they come together and address them.
I would be more than happy to do that. It's a process, and the process isn't very clear cut when you're trying to pull families together to do something like this. You know, DDS is primarily looking at emergency placement for folks, but there is a self-directed piece, you know, but I've only had experience working just with DDS funds and consumers. You know, now more and more families are receiving CFC, and combining these sources it's challenging. So that we really need clarification on, and I'll be happy to put together a list.
That would as well. And I wonder if it might be beneficial to have Dawn there as well.
Well, that's what I was going to say. Dawn is great. She's also, I've presented with her in the past, and she very well may present herself. Sometimes she, because she manages so much, is limited in her time. So maybe Lori, since you're connecting with her right now, if you can run this past her and see if or if it's either her or somebody else that would be in the position to do this. And you're right, they're more than generous with their time, and they're trying to spread this information.
Yeah, the individual I spoke with said that Dawn is really hard to get a hold of. I mean, I have emailed her in the past. I don't know about a presentation, but there is somebody who works very closely with Dawn.
Is it Carrie?
Is she a nurse? I don't think it's Carrie. No, I don't think it's Carrie. So I will get clarification, and I'll see if somebody can possibly present, you know, help us with this.
That would be great. That would be just, I think, so useful.
Now, on the DDS side, I don't know if Stacy, someone like Amy, would be able to help with this. I mean, I'm running into some snags down in the South region, but I do know Amy. You know, it would just be so helpful to have some kind of roadmap for families to follow, you know, or for me to follow to assist families. But I'm having a hard time with that piece. And I don't know if Amy would be the person that might be able to help us.
That was the first person I thought of when Kathleen had mentioned a DDS representative, since she's the self-determination director. But, you know, I understand it would be also great to have the questions also, as Kathleen had, you know, had suggested, because, you know, we'd like to say that there is a roadmap to everything, but, you know, each individual has, you know, there's still individuality into planning these kind of developments for families. So no development's ever the same when you're doing this creative process.
Okay, great. And Kim, I'll get with you. You will have a conversation beforehand, okay? Perfect.
Great. Okay, so it sounds like, in summary, that next meeting I will present on special needs trusts and decision-making options, and that will be an open meeting to all of the RACs and anyone else that wants to be invited. And then in terms of when we pick up again in September, on the meeting, we would have meeting agendas. We would work in a round table in terms of being able to navigate issues with DDS, and then a subsequent meeting where we have the DSS and DDS liaisons to help us navigate some housing funding coordination.
Kathleen, it's Lori again. I've also had families ask many questions about their son or daughter's SSI and using it for other purposes, possibly staffing, which I believe that they can, you know. Now, if, and I don't know, if a consumer is in a group home and the family is the rep pay, or the agency is always the rep payee if it's a CLA. Is that true, or most likely that's the case?
Yes, generally speaking.
Okay.
Yes.
Okay. I mean, my daughter's in a CRS and we're the rep payee and we pay all the bills. But if families want to utilize discretionary funds, how do they go about doing that? They basically ask the agency for what they might want to use funding for?
Yes.
Yeah, I'm right. There's a family that is daughter's in a group home, but they want to hire someone to work 3 times a week with her to implement some physical therapy and some other types of things along those lines. So it's sort of a sticky subject when the family is not the rep payee.
Yeah, well, if it's this is Kathleen, if it's a CLA, then my understanding is that all of the Social Security is getting paid over to the facility, which would be different from like a CRS where you have a set rental rate. So my question would be what funds they want to pull from, because if everything is basically paid to the CLA, then there really isn't anything left.
Okay. And then that was a question I couldn't find a lot of information on, if the funding went directly to the agency. You know, I didn't know if there was discretionary funding still left over from the Social Security that families could access or not.
Yes, I mean, there should be like a personal needs allowance, and I don't know what that is per se in the CLA, but it's probably not going to be more than $100 or $200 a month.
A month, okay.
But I'm not positive of the numbers.
Yeah. Okay. All right. Thank you.
Okay. Does anyone have any other presentation ideas? Okay. All right, so next up on the agenda, before we move on to, I think we're at the public participation forum, I did want to mention that I am going to be resigning from my role as chair due to some exciting personal news. I'm expecting my first baby in July. So I'm just trying to balance out and make sure that I have a little bit more space in my life for whatever my schedule might entail. I still will be an active participant in the RAC throughout next year, but just wanted to let everybody know that, and that does put us in a position where we would need to seek nominations to fill the role. And we can do that now. If anybody has any nominations or it's something that we can think about, we don't meet over the summer. So next month will be our last meeting. Given that it's going to be a combined meeting, I'm sure that we can still have a business section allocated to handle these questions. So it's just something to think about if no one has anything in mind right now. All right, so that leads us to the public forum. Does anybody have anything that they would like to bring to the table? Lori, your hand is from earlier, right? Okay. All right, very good. So I think that brings us to the end of our agenda this evening. Stacy, thank you again, and welcome again. We're very happy to have you. And so it is 5:48. Is there a motion to adjourn the meeting?
I'll adjourn.
Thank-
Annette Scully, I'll adjourn.
Thank you, Annette. And can someone please second?
Second.
All right. Unless there are any objections, that brings the meeting to an end. Thank you, everybody. And
Congratulations.
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 Yeah,
Thank you.
congratulations.
We're very happy. Thank you.
Very exciting.
Bye-bye.
Yeah, I appreciate that.
May he or she be happy and healthy, or healthy and happy.
Thank
Happy
you.
and healthy.
Yeah.
It'll be a surprise. I don't know who's in there yet.
Okay. Good night,
All right.
everyone.
Good night.
Thanks,
Have a great
everybody.
night.
Have a
Bye.
good
Hi, everyone. Bye.
Bye.